Should we go ahead and get started, or are we waiting for Rochelle?
Go ahead and get started.
Okay, go ahead.
Thanks, Tracy. I appreciate everyone's patience. Thank you so much. You would think, living in this COVID-related world and all these Zooms and Teams and WebEx meetings, we have everything down pretty precise, but wish we could be up there today. But unfortunately, due to some difficulties getting up there, we have to do this virtually. And hopefully next year I'll be able to get up there, or maybe come up the time of renewal and answer any questions. But really appreciate everyone's time today. I know we have 75 minutes blocked out to kind of walk through this presentation and also answer any questions as we go along. I'll start off by saying here at United Healthcare Student Resources, we're excited to be working with Michigan Tech. I believe we worked on the account previously in the past years. I know it went through a few different carriers. So we're excited to be back, and then also working with Aon and Rochelle, who I know should be joining the meeting shortly now. But again, we're glad to have this opportunity to meet. We're excited to learn more about Michigan Tech and their needs, and then for everyone here to learn more about UHCSR, the student division at United Healthcare, and our capabilities. So I know we kind of did a brief intro of who's going to be here, but I'll just let Tracy and Sean speak to themselves. So I'll introduce myself first real quick. My name is Alec Dollard. I'm an account executive here with United Healthcare Student Resources. I've been doing this for 4.5 years in the student market. Again, work with large size public universities, small size private universities, coast to coast. So I have clients in Florida, Maine, California, Michigan, obviously. So really all over the place, kind of see a little bit of everything. But definitely glad to be working on this account with you all. So I'll turn it over to Tracy, just do a quick introduction, and then Sean.
Good afternoon, everybody. My name is Tracy Martin. I'm a client service analyst that works very closely with Alec Dollard on the Michigan account. I'm very happy to meet all of you guys. Alec and I are the main point of contacts here at United Healthcare Student Resources, so please continue to reach out to us with any of your needs. Thank you.
Hello, everyone. My name is Sean Dagenhart. I'm the Senior Capability Manager here at United Healthcare Student Resources. I'm actually based in our Texas office. So this is where our customer service department is, the claims team, the IT team are all based out of the Texas office. So me and my team are here in Texas. We support the sales team on our ancillary products. That includes your telehealth benefits, the global assistance services, as well as your dental and vision products. So happy to be part of the team this morning.
Great. Thanks, Sean. And just let everyone else know, myself and Tracy, we're based out of the Tampa, Florida location here. And I must say, when I had a chance to meet with Joanne up there, going from Florida to Michigan, and I think it might have been August. I can't remember exactly when, or June or July, sometime in the summer. And being in Florida, it's so hot. And I think I needed a sweatshirt when I went up there, and couldn't believe that sunset doesn't go down until like 10 o'clock. So that was quite the change for me, but what a beautiful area that you all have up there and are able to go to school. So Tracy, we can move on. Next slide. Great. So I know we received an agenda, and we're going to cover all the topics that were addressed. You won't see everything outlined exactly here. This is a broader overview of what we're going to speak to. So really, we're going to kind of talk about who we are at United Healthcare Student Resources and the history of how we became who we are, and then also our presence in the marketplace. Then we'll go over our student resources overview. So really, we'll talk about the custom web page for Michigan Tech, how to access ID cards, your My Account page, how to navigate that and view your ancillary products, the Find My Provider tools, cost estimator tools, all that stuff will be overviewed in that section. Then we'll move on to our Student Help Center, which will really just talk about primarily our UHCSR website. So this will kind of lead to frequently asked questions to overview, glossary for health insurance terms, plenty of educational videos, and so forth. Next, we'll talk about our customer service team, how to reach them, what the operations look like, when they're available to be in contact with, how to contact them. And then I'll also talk about the Michigan PIP and auto insurance during that section as well, and where we stand with that. Next, we'll move on to our overview of benefits, where really all we are going to go over today is just the summary brochure that's accessible on UHCSR.com. Obviously, we have a full certificate, which is going to be 100 and some pages. But really today, we're just going to do a high level overview. And then if there's additional questions that come up today, I'll do my best to answer them. And if not, they can submit it for questions and I can work with our teams internally to get any of those additional questions addressed. During this section, I know there was a part on the agenda in regards to preventive care services. That's really a loaded question asking what is covered and what is not. So what I will do is I'll walk through some high level overview and some steps of how to access these guidelines and kind of answer what I can. Normally we would like to have our claims team here, but they're very precise in how to go into certain specific scenarios. So I'll have a kind of guideline for you all to how to get those questions answered. And then next I will turn it over to Sean and she will speak on dental and Surebridge. Thanks, Tracy. So this first slide is really who we are. So here at United Healthcare Student Resources, we're the student division of United Healthcare, clearly, and we are 100% dedicated to students. So we've been doing this 40 years. Myself, Tracy, Sean, the rest of our team, all we focus on is the student market. So helping colleges and universities. We don't do any employee benefits. We don't do any of the PNC. So we're 100% dedicated to the students. Back in 2006, we were just student resources. And then at that moment, United Healthcare acquired us. At that point, I think they were only working with 5 universities. And as you can see now, we service over 450 colleges and close to 500,000 students. So we're pretty large here in the student market. We'd like to say that we are the largest from servicing colleges and members. With that being said, we work with schools that only have 300 members on it that might be private and small. And then we have some larger public universities that could have up to 30,000 students. So we here are prepared to kind of work with any kind of stuff the school has and kind of have really seen any sorts of issues, whether it's coming from a small university or a large university. In Michigan, obviously we're working with Michigan Tech now, which we're very happy to do. And then we work with Eastern Michigan University, Calvin University, and Oakland University. I will like to add that we do have our own PBM here. So that's through Optum. We are licensed in all 50 states. We have over 1.4 million providers, 6,600 hospitals, and 66,000 pharmacies. So that just goes to show how large our network is. And what I'd like to point out is that we are a national network. So if you're going back home to, say, Virginia or California, over winter break or summer break, you're going to be covered under the United Healthcare Choice Plus network, which is what Michigan Tech has selected, which is our best network with deeper discounts. So it's very important to realize that it's a proprietary national network where you'll have access to it in all 50 states. And then I would like to add here at the bottom, we do have, I'll talk a little bit about it. It's not something that's implemented quite yet, but we do have our own waiver tools. That's just something that we can maybe discuss for next year if the administrators at Michigan Tech would like to use our waiver tools, and we have our own student center for students to access all that. But that's currently not in place, but just let the administrators know and anybody on the committee that that is at no additional cost to the university. Great. So this next session, we'll kind of go over the student resources overview. So Tracy, we can go to the next slide here. So really the hub for everyone here would be this uhcsr.com page. We did create a customized link for Michigan Tech. So that link is going to be uhcsr.com and it's a /MTU. So on this page here, you'll have your policy documents and you'll be able to do provider searches. So these policy documents really will have your summary brochure and your certificate. The certificate is that one page, the document that I was talking about, that's going to be over 100 pages long. It's going to have all the state mandates, exclusions, limitations, all the benefits, eligibility. So that's like the big main page to go to there. For looking up provider searches, there is a link on this page when you go to uhcsr.com/MTU, where you'll see up here, there's a Find My Providers. So when you click on that link, it'll take you to either whether you want to select medical or behavioral health. And you go through there and you select your zip code and you can kind of look up by what you're looking for a provider. You can filter it by gender, proximity. If you're looking for a specific provider, you can type in their name, and then it'll also show if they're in network or out of network, and if they're accepting new patients or not. Other links that are helpful on this page, underneath helpful links, you'll see prescription drug list, which is updated 3 times a year. You'll be able to access our help center from the uhcsr.com page, which I will go into more detail later. And then also, if the university does decide, we have not had this conversation yet, if they want custom pics or logos on their page, we can set that up. So when you go to this landing page, it could be more Michigan Tech University oriented from a logo perspective. So if that's something that's interested, either Joanne or Samantha can reach out and we can work on getting that uploaded. Okay, let me go to the next slide now. All right, so this is the next kind of highlight that we live in a very digital world, obviously. I think, including myself, I think we're on our phones a lot more than what it ever was maybe back 10 or even 12 years ago, right? I mean, I remember the first iPhone coming out and kind of broke the world there. And now, I mean, heck, everything's on this iPhone or Android or whatever we have. So we figure it's very important to make sure that all of our tools are accessible to you all via whether it's working on your phone or a computer or a mobile app, such forth. So if you're able to access your school specific page, all those videos, help center, any FAQs right in the palm of your hand. So if you all want to play around on your phone to access these sites, you can see it's very mobile friendly. We are in compliance with the Americans Disability Act. And if you want to download the mobile app, that is also accessible for you all as well. And as I mentioned earlier, it's not in place at Michigan Tech University right now, but if there was to be the waiver set up through United Healthcare Student Resources, you'd be able to waive coverage right there on your mobile phone as well. But again, that may be a discussion for 23 for renewal, not quite 22-23, as we should be done with that process almost. Okay, so this is a very important page right here. If you all want to take a picture or kind of go through it right now through your phone, this is uhcsr.com/my account. So this is how you'll access your My Account page here. So this is what you'll see pop up on your screen. So I'll walk through these here. You can view your claims and balances. You can submit a claim through here, request for reimbursement. You have full access to your ID card. So if you're at the doctor's office and you're kind of panicking and you don't know how to access it, all you have to do is go to this link, put in your information, your username and password, and then you pull it up right there for the provider. All coverage information will be available. If you need to appoint a personal representative, whether that's someone at the university or a mom and dad, you can do that as well. There's going to be a form attached that you can fill out all necessary information. You're going to have your benefits here. So if you want to access your summary brochure or certificate while you're right there in the My Account page, you can pull it up all right there. Additional benefits, you'll be able to access all your ancillary products. So the telehealth, which I'll talk about a little bit in a second. We have a 24/7 crisis counseling support. So if you click on that, you'll have immediate access to a licensed clinician. Looks like Michigan Tech does allow dependent enrollment. So if you're to enroll a dependent here, you can do that through your My Account page. And of course, if you need any questions, you can use this Need Assistance link here and ask your questions in the chat, and we will get back to you to provide an answer to your response. This next slide over here to the right, you'll see the Find My Medical Provider and Estimate. Oh, sorry, Tracy, let me go one back. I didn't mean to say slide there. The third column over here. It's Find Medical Provider and Estimate Costs. So I know we talked about being able to find providers just through the UHCSR link, but this is more designed to the Michigan Tech plan and who you are. So you'll be able to find your providers here. And then if you're needing a specific procedure done, you can put that in with that provider, and then you can see the cost estimate of what that's going to cost to you. So it's a pretty cool feature. A lot of students use it, and we receive tremendous feedback on it. And then also you can find mental health resources as well here. And then if there was a student health center, we would add information there. The telehealth medical and mental health is through a company we partner with called Healthy-ish-You. Samantha, I don't know or Joanne, if we've sent any kind of brochures or flyers over to you on that, but If we have not, I can have myself and Tracy send them over to you so you can get those out to the students. But really you'll have access, 24/7 access to medical doctors via the app, and then mental health services. It's not 24/7. Sean, I don't mean to put you on the spot. Do you know what those hours are though?
It really depends on the provider, Alec.
Okay.
You go in and pick your provider, and then you'll be able to see that provider's availability. But we do have providers on the platform that are available 7 days a week and even in the evenings. It just depends on the provider you pick.
Okay, great. And that does include psychiatrists as well, right?
It does, yes.
Great. Thank you.
Mhm.
And then this tabs down here, if you're looking for a nearby pharmacy, you can search that in there based off your zip code. And then this last section here is the not sure where to go. It's kind of a marketing campaign we did back a few years ago. Where to go for care, right? If you have a just a little sniffle or cold, the first stop might not be the emergency room, right? Because there might be a larger copay associated with that. You might want to go to a telehealth visit or maybe an urgent care first, right? To save costs. But really, this is a good resource for you all to kind of play around on the My Account page. Obviously, you'll see at the top, if you have any notifications, you'll want to kind of answer to those as soon as possible and stay in the loop. So let me go to the next slide. Great. So this next slide really kind of talks about ID cards and how quickly they're available. So they're available on My Account same day, as I mentioned. So if you're at the provider's office, all you have to do is log into the My Account page and access your ID card right there. So the emails are generated to you all 48 hours later. That's Monday through Friday, so 2 business days. If you have not received them and you're requesting them, and then that email directs you to how to take action and how to access it. It's available on our app, so you can view the iCard image or fax or email the image from the phone to the provider. So it's right there. We have a visual view for you to see how that looks, because if the provider sometimes says, hey, I know you're showing it to me, but we need it in an email or fax it over. It's a pretty simple process to get that through. And then if you're logging in just through a regular PC or web capabilities, you can print the PDF, or if you really want to. We don't do as much as this, but you can request an ID card to be mailed to you. That kind of goes back to being the digital world that we live in. Obviously, back in the day, everyone would get an ID card shipped to them, but we really don't see that request come in as much anymore. All right, next slide, thank you. Next, this talks about our Student Help Center. So this is kind of our main landing page here at uhcsr.com. So what you'll see here is there's going to be multiple places that you can kind of click onto. So in the upper right corner, if you want to log into your My Account through this page, you can. Obviously, I'm sure everyone is all familiar with COVID-19. We're constantly providing updates on that. So if you click on there, you can access any kind of COVID-19 updates that we have or any frequently asked questions about COVID-19. And then what we'll talk about here is also the Student Help Center down there that's at the bottom left. And then also if the school admins had any questions, they can click on that page over to the right. We can go to the next slide and I can show you what the Student Help Center looks like. So here at the Student Help Center, if you want to go to the direct page, you just go to uhcsr.com/help-center, or you can go through the process that I just explained there, uhcsr.com, and just click on the link. So here comes back, you can create My Account. You can find a provider. How do you get your ID card? Buy insurance, this really isn't for you all since you're already on the plan. And then these bottom 4 marks here is really what I want to focus on. So you'll have a tab for frequently asked questions. So there are several frequently asked questions there at the bottom. I mean, any regards to the ACA, so the Affordable Care Act, COVID-19, as I mentioned, emergency medical care options, how to use your benefits, and if you're just trying to learn more about your plan. So it's a really good place if you have a lot of questions that you feel might be basic and you want to go there first and check in before reaching out to customer service or Samantha or anyone at the university. Next, we have a glossary, so basic definitions. If you're looking for, okay, what is a deductible, or what does out-of-pocket maximum mean, or co-insurance or pre-authorization. So if you're reading through the certificate or summary brochure and a word jumps out to you and you really don't know what it means, we have a glossary right there for you to access that provides definitions of these terms. We also have the Health Insurance 101 tab. Again, this gives you more information about the Affordable Care Act. What is health insurance? How does it work, etc. So just a quick little one pager about health insurance there. And then really where we see a lot of students click on here is this video section. So they have kind of just talking about what's a deductible, what's co-insurance, what's a copay. And then really the greatest part about these videos are the how-tos, right? So how to access your My Account, how to request an ID card, how to check a claim status, how to submit a claim, how to submit accident details, how to find a provider cost and estimator tool, or how to submit a PRA. So if you're stuck going through something and you feel like you're doing it right, there might be a video out there that might help you kind of complete it if you're kind of stuck. Of course, obviously myself, Tracy, are here for you, and so is the customer service team, but I do recommend exploring these videos as they're extremely helpful and we do see a lot of students work through them. Okay, next slide. All right. So here, I know the slide's a little wordy, but I think it's important to have here. I mean, kind of gives you everything that you kind of really need to about customer service on a high level basis. So our customer service department offers students, administrators, and providers access to live representatives. So we have a full staff that's based out of our Texas office that kind of handles all these students. They are all trained. They go through a 6-week training course, pretty rigorous, to provide best-in-class service. In addition to training in customer service relations and telephone etiquette, our customer service representatives are also cross-trained on claims processing in order to better understand the claim issues students may have. So this is really important. You're just not getting across the customer service representative. You're getting someone who is most likely really understanding what you're asking your question here about. We do have a group of supervisors as well. So if a customer service rep kind of gets stuck on a question or a call is taking too long, we do have a team that can monitor that, and we can bring in a supervisor to better address your questions. So with that being said, all of our calls are 100% recorded. So if there's anything that comes up and there's a complaint that may arise, myself and Tracy can work with our customer service director to pull these calls, and then we can get involved to help us assist. So our goal here is to really help every Michigan Tech University student address any needs that they have when they call our customer service line. Now they are available from Monday through Friday, 7 a.m. to 7 p.m. Central. So that'd be 8 to 8 Eastern. And also there is a email address. So if you want to email them, it is customerservice@uhcsr.com. And then there's also a chat feature, which I mentioned there. If you can go through your My Account if you have questions that you can ask for the need assistance. And also I will add, we do have an IVR system available 24/7. So they deliver accurate information regarding coverage, claim status, claim history, and member demographics. So I did mention here, I would talk a little bit. I know there was a bullet mark here on the PIP and auto insurance. So this is something that's kind of arisen. It's kind of new. It's a new law that came in place with Michigan, right? So it's kind of new to us that we're working with here. And I know back in the past, Blue Cross Blue Shield would send out a letter to you all. So I did work with my team internally, and I apologize for the delay, but we do have a letter that'll be sent out. I've shared this with Aon, and I believe it's been shared with the university. But if you would like this letter, you would have to reach out to our customer service team. And then we have a team now dedicated to handle these requests. And then these letters will be sent out to you. And it's really talking about the Michigan's auto insurance allows individuals who have qualified health coverage to make choices regarding their auto no fault insurance coverage, right? So it'll talk about what qualified health coverage means for your coverage, and it will point out saying qualified health coverage does not exclude or limit coverage for motor vehicle accidents. And it also has an annual deductible of $6,000 or less per covered individual. But this current moment, it obviously meets the annual deductible of $6,000 or less, as I think, well, we'll get to it shortly, but I think the in-network deductible is $150. But at this current moment, it does exclude or limit coverage for motor vehicle accidents, as you would see in exclusion 19 in the certificate and summary brochure. And as a few of you know, maybe, and then I know the school administrators, that we had a list of exclusions that were requested to be removed a few weeks ago, and we did approve all those exclusions. This exclusion was not on that list, so that is why that exclusion is still in there. All right, if we can go to the next slide, please. Great. So this is where we'll talk about the plan overview, where I have the pieces of the summary brochure and a quick little benefit structure pulled up here. So really, I can't stress enough how great of a plan this really is. When you go out into the employee world, you will not be able to find a plan this great, or even on the marketplace. It's not out there. So being a student here at Michigan Tech, you really have a great plan. So it's a platinum level plan, which is the best of the best. Let's see, the premium is $2,151 on an annual basis. I will say that's definitely, if you explore other universities, that is definitely a very, very fair and reasonable cost compared to other universities for sure of this size. And especially schools with graduate populations that are pretty large, you even see that number go up even higher, closer up in the 3,000 and 4,000. So obviously each university is different, and we look at each university as one individual school. So when we're looking at pricing, that makes an impact. So we'll review claims, enrollment history over the past 3 years, roughly or so. As mentioned, got that national network, and it's UHC Choice Plus, which is our premier best network. There's no overall maximum dollar limit to the policy. So obviously this is an ACA compliant plan. The plan deductible is $150 per insured person per policy year, and then $300 for out of network. And then for the family, it's $300 in, $600 out. The out-of-pocket maximum is $5,000 per insured person, $10,000 for the families, and then out of network is $10,000 and $20,000. I believe the ACA limit is $87.50. So you can see you're even below the ACA maximum right there. Co-insurance is 80% of allowed amount expenses for covered medical expenses here for the preferred providers, as in network, and then out of network is 60%. So as recommended, when you're going to that Find My Provider tool, make sure you're paying close attention to see if a provider is in network versus out of network, because there will be definitely a difference in cost of what's subject to the to you all as the student. Next here in prescription drugs, you'll see here for tier 1 and tier 2 and tier 3. If you remember, I previously talked on the UHCSR.com page about how to access our prescription drug list. All that information will be there under the helpful links under the UHCSR.com/MTU. And then you can see it's a very favorable copay structure here. It's $10 for tier 1, $40 for tier 2, and $80 for tier 3. Go to the next slide, please. So I'll get to preventive care services in a second, because we'll talk a little bit more about that. But you can see the following services that have copay. So physician visit, $20, medical emergency. So going to the emergency room is only $50, which is extremely low for the student market. I would say most colleges and universities have that anywhere between $150 and $300. And then obviously that $50 copay would be waived if you were admitted. And then for any outpatient mental illness or substance use disorder treatment, those office visits would be a $20 copay as well. So there was a question here about preventive care services, what is covered and what is not. So as I mentioned, that is a really loaded question, and probably could spend just a whole hour talking on that. So what I did is I worked with someone in our claims department, and really what I will send over to Samantha and Joanne later is really our preventative care list and our coverage determination guidelines. So What's important here is that obviously all these guidelines are subject to change. So it's always best to go out to a website and find the most current guidelines. So I will send those instructions as well. But what I always like to point out is that on these guidelines that there are 3 columns. So the left column will explain the Preventative Care Task Force guidelines. The middle column will show the procedure codes and diagnosis codes that would be considered. That's where it gets a little confusion, even for myself a little bit, right? So that's more of a provider language. So they'd be able to understand what's there better than myself or a student. And then the right column, which is an important column, is the UHC requirements for these codes. And you'll be able to see that these UHC requirements are more lenient than the Preventative Care Task Force guidelines, which is definitely in favor for the students. So to access these coverage for determination guidelines, you would go to, and again, I will send all this information out. You will go to uhcprovider.com. Then you will select resources on the drop-down menu. And once that pops up, you will see a subtitle here in the upper left corner that says plans, policies, protocols, and guides. And you will click on that. And then once that pops up for policies and protocols, you'll want to click on commercial plans. And after commercial plans, you will click on medical and drug policies and coverage determination guidelines for United Healthcare commercial plans, as that is what we would be going for.
Hey, Alec, are you
Yeah.
trying to show us that? Because it's
No.
just,
Yeah, I don't have access to be able to show that right now, because that's proprietary and I can't quite show it here, but that's something that I'll have to send to you, Samantha or Joanne, and then be able to distribute out to the students if that's okay. I just didn't know if anyone was taking notes or trying to follow along on their phone to access it right now.
a little confused. Thank you.
Hello? Oh, yep, no problem, no problem. Yep. So, and then right there, you'll be able to access all the coverage for determination guidelines. You'll want to type in preventive because that's what we're looking for. But as mentioned, I know it's tough just following as I talk here, but that's the best way that I was allowed to do it for certain reasons here. But I will be able to send everything out to Joanne and Samantha on how to access these guidelines. And then really any questions that you have should be able to be answered through those guidelines. But obviously, if there's additional questions, you can obviously contact our customer service team or reach out to Samantha or Joanne and then get the questions back to myself and Tracy. And then we would be able to go from there and answer any specific related questions in regards. And sorry, I couldn't go into more detail, but really it's a very loaded question. And I don't want to steer you in the wrong way, but I will say if you're getting something done and you believe it meets the preventative care services, I would just bring in those guidelines to the provider and show what checks the marks here to make sure that it is being covered at 100% if you truly believe you meet all those requirements. All right, next slide. So here I'm going to turn it over to Sean, who will talk about Surebridge.
All right, thank you, Alec. I'm going to steal the screen from you, Tracy, if I can. Okay, let me know if you can see my big blue webpage.
Yeah.
Okay, perfect. So this is our uhcsr.com homepage. This is for students who are interested in the dental and vision products can start here. As Alec mentioned, you can either go to our homepage and type in Michigan Tech, or you can do the quick link uhcsr.com/MTU. We'll get you to the same page. So this is our homepage live. This is the generic picture that Alec mentioned. We would love to get a picture of your campus or your students to load here, just to give students that good feeling that they're in the right place. So down here, we have our policy card. Students can come here to learn about their medical plan, or they can pop over here to the voluntary dental and vision and click read more. That will take them to this little interim page. And this introduces Surebridge. Surebridge is our partner providing our dental and vision products to the students at Michigan Tech. Gives them a little information about the plan and how to go about getting enrolled. Click on this Surebridge link. And that takes us to this microsite Surebridge. That's built for our students. Now from this site, the students can learn more information about the plans. In general, we provide a basic dental plan, a premier dental plan, a vision plan, and then there's also a combined dental, vision, and hearing plan available. So students can click on this learn more on each of these to learn a little bit more about the plan. This is just like overview. The details will give them a comparison between the basic and the premier so they can figure out, which works best for them, what's covered under each. Sliding down. Is there a question?
No.
Okay. Let me know if I need to speak up. I got my headset on here. This will show you type 1, type 2, type 3, what's covered under each plan. And then let me show you these little fine print notes down here. We'll tell you what you're going to get paid at in-network and out-of-network between the two plans. So you can see the difference between the 80% and then the 50% between the basic and the premier. So this is just a quick overview of the plan and what's paid under each. And then here, I wanted to show you under this FAQs, students want to see if their dentist is in network or if there are in-network dentists near them. They can click on this. How do I know if my dentist is in my network? And this will take you over to this Carrington site. Carrington is actually the administrator for the dental plan. They'll pay your claims. They'll handle your customer service calls. You can look at this Find Provider.
Hey, Sean.
Yes, ma'am.
Question. So when someone's trying to figure out, like, let's say they call a dental provider, would they say Surebridge or Carrington when they're looking to see if that person's in network?
They'll say Surebridge. Sure. I actually think they could say either and be okay, but the plan is actually a Surebridge dental plan. So that's what I would recommend. Okay, I wanted to show you this. This is where you can come. You can filter down by your provider type if you're looking for a specific type of provider. I'm going to type in the beautiful Michigan zip code that I looked up. All right, so this is going to show me the 25 nearest providers in my zip code. And I'm taking the time to show you this because I know we had a question about this accepting plan, DTMX. I passed this by Surebridge just to make 100% sure, and they said yes, DTMX is considered in network for the Surebridge plans. In fact, anything in this list right here, if any of those providers say they're accepting these networks, they're going to be in network for the Surebridge plan. So just a little extra information there. Also, if you have a favorite dentist that's not in the network, or there's a dentist local that you know a lot of students access and they're not in the network, you can use this nominate a provider link, and that will initiate contact for Surebridge to reach out to that provider and see if they can work out a deal to get them in the network. So that's just quick. Find a provider. The same thing for vision. They can see what's covered under the plan under these little helpful hints. And then FAQ also has a lookup for vision providers. So it works very much the same. This takes you over to iMed Vision Care, which is the administrator for the vision plan. They can type in their zip code and find a provider near them. Make sure there are providers close to their location. Now, a student decides, yep, this looks good for me. The next step is to click on this free quote. They can, you can see I've been playing in here. They can put in their basic information. I gave my daughter's birthday. I didn't want to give my age away. I put in the Michigan Tech zip code, and you click get a quote. And it's going to give me a personal quote. And you can see these are my options based on the information I provided. This is that dental, vision, hearing combo plan. It's $42 a month, but if you see, I can change my benefit level. So if I'm like, ooh, that's a little rich for me, I know I'm not going to need much done this year, you can drop that down and see it significantly changes your price. Or you can just go for the basic dental and vision. This little link here pulls up a brochure for that specific plan. I think this is awesome. Gives you a lot of detailed information on that plan and what it covers. So you can see here's your hearing, your vision. So you'll have a very good idea going into it exactly what's going to be available for you. All right. So I decide I'm going to go for the big tamale here and do the whole combo. I hit view quote summary. That's going to give me my monthly premium. I'm like, yep, that looks good to me. I'll hit apply. I'm going to stop here because I don't want to bombard Surebridge with a bunch of extra quotes. But from here, you'll put in your email address, you hit next. It's going to ask for some demographic information. You can put in your payment information. The beautiful thing about these plans is that students can pay monthly, they can pay quarterly, they can pay semi-annually, or they can pay annually and just get it all over with. So there's a lot of flexibility in these plans that we haven't had before, which was why we were so excited to be able to roll them out this year to our members, because before they could only buy annual and only in the first 45 days of the policy. This product, they can come in and buy at any point throughout the year. They don't have to enroll at the beginning of the policy year. I think that's about it. Once you enter your payment information, they'll send you a document to sign through DocuSign, and then it takes a couple days to get the coverage, loaded down into the Surebridge and then into the Carrington and the iMed systems, and then you're good to go. You'll get an email that tells you how to access your account, get your ID cards, look up providers, all that fun stuff. And yeah, I think that's about it for an overview. I wanted to leave a little time for questions if anybody has any.
So thank you. I'll go with first question that I have about the dental vision plan. So you mentioned that if I understood correctly, that they can buy the plan anytime they want. They don't need to do it within first 45 days of their healthcare plan, right?
That's right. Mm-hmm.
And how? So if I buy, say, 2-month plan, how would that work? Can I buy ahead of a surgery, and when can I? How long do I have to be enrolled in the plan to use the benefits?
Okay, that's a great question. There are some waiting periods. You may have seen that. I'm going to back up a little bit here. There are a few waiting periods built in, and that kind of protects Surebridge and Carrington for those people that run out and buy it once they realize they need to have coverage done. So in between the basic and premier, there are a few wait periods in here. Now, I will say, if you had prior dental coverage, you can put your information in during the enrollment process and it will waive those waiting periods. So you could theoretically go and buy a month and get your surgery done and then cancel it if you had prior insurance and were able to waive. But let me show you in here. Gosh, I thought it was in here. Yes, see here, if you need this big tier 3 kind of care, you'll see on this premier plan, there's a 12-month waiting period. So just know that going in, you're going to have the coverage for 12 months before these big services are going to be covered if you didn't have that prior dental coverage.
Just a follow up.
Mm-hmm.
Oh, go ahead.
No, I was just going to say, does that answer your question?
It does. I have a follow up on this. So, for example, most of the students were in Blue Cross Blue Shield, Michigan's plan last year, and dental and vision were covered. That plan expired on August 15th. Now, let's say a student wants to enroll in a plan next month in this one. Would that plan be still considered as that the student was covered, or because they were not covered for the last 2 months, it won't be covered? How would that work?
Okay, I see what you're saying. And yes, that's a great question. I I would like to check on that just to confirm with Surebridge what the gap they're going to allow in the coverage is. I wouldn't want to say and be wrong. So if you don't mind, let me take that back and get an answer back to you through Tracy and Alec.
Great, thank you so much.
And I would
Sure.
like to add something just because I used to work in a dental office and manage that. If any of you have tried to get in at a dental office recently, and let's say you sign up today for a plan for 3 months, I almost guarantee you, you're not going to get a new provider appointment in 3 months. Just be aware of that. So if I were you, I'd be signing up for a provider appointment in advance of when you think you might need it. Just know that around here, they're very full. So just be cautious when you're thinking, oh, I'm gonna buy a plan and then use it in 2 months. You might not be able to get in for a while. Just, yeah, vision is the same way for anybody with any plan anywhere here. I don't know if you've come across that, anybody yet. No, not yet. You will.
Okay, that's a good point, and those are great questions. Definitely want to get an answer for you, and that's good information for us to have going forward. Like I said, this is our first year offering Surebridge, so we are excited and also learning as we go. So any feedback you can give us once you kind of dig in and learn the plan, we are very appreciative of.
Okay, it looks like we have another question here.
Okay.
Hi, Shauna. Is there any way that you can mention on the website when people search for providers and we only see Dentimax? Is there a way that you can have information just on there when the list of providers comes up that they accept Carrington or Surebridge as well? Because from a student's perspective, one of the things that has happened is that students have seen Dentimax, and we would think that a person who needs some help, they would reach out to the local dentist office or someone and ask whether this plan is accepted or not. But when things like the online tools are pushed so much, we would look at, okay, I don't see any mention of Carrington or Surebridge, which means that the dental plan is not accepted, and then panic that, oh, the plan that we have is not accepted. And that has led to panic in the past. So is there a way that you can just mention against the providers who you do say that even though it just lists Dentimax, can you just list Carrington as well? Or is that not possible?
I can ask. This is a Carrington website, but we can take the suggestion back and tell them, this is the feedback we're getting from our clients. They're finding this a little confusing and a little concerning, especially if it's preventing them from purchasing the plan. They're going to want to know that. So I think it's a great suggestion, and I'm happy to take it to Carrington and ask if that's something they can consider.
Thank you.
Sure. Great suggestion. Okay, anything else before I hand it back over to Alec?
I do have a question, and I only know this because I worked in the dental field before. Can you scroll down just a little bit for these dental providers?
Yes, ma'am.
So we're looking at Liliana Kostinsky. I know she's a dentist in Houghton, and Leonard Beasley is a dentist in Hancock, but I don't recognize any of the three in the middle.
These three.
Those three. I'm wondering, I pulled up the address online, and it looks like they might be associated with Portage Health. So maybe they're part of maybe the Calumet office, but I don't recognize those names. I mean, I could be out of the loop because I've been out for a while, but I don't recognize any of those names in the middle. I'd like more information about those providers if at all possible, because I don't recognize those as being dental providers in the area. I'm gonna look at that website for the Upper Great Lakes Family Health Center, who's actually based in Calumet. Maybe they're new there.
Okay. Yes, obviously I'm not familiar with Michigan, but I would think they must probably be related to this same facility since they're have the same address. And yeah, it looks like they're all in the same group. But yeah, it's kind of odd that being so familiar with it that you wouldn't have heard of them before. Just, double checking to make sure that this is obviously displaying accurate information. And if you want to look up on your end, I will also take it to Carrington and say, hey, can you provide a little more information on this Prime Health? We're seeing some providers that aren't necessarily familiar, really close to campus.
Yeah, I'm gonna look those up because I do know that they might have some turnover. These could be new providers in that particular area.
Yeah, there is this little link to click and see additional information, but I don't see much here that would really help our little investigation.
I'll do some research on my end. I'll just call that office.
Okay.
I think it's Upper Great Lakes Family Health Center actually. That they have a affiliation with Surebridge Health, which is, that address is attached to. That might actually.
Okay.
This is Tracy, and if you find that after your research you have any additional questions, please feel free to reach out to Alec and I, and we'll get with Sean to see if we can get those answered.
Okay, sounds good. Thank you.
Okay, I think Tracy's telling me I went over my 10 minutes, so I'm going to stop there. If there are any other questions, unless there's some short minute here, you can shoot those over to Tracy and Alec. My team is phenomenal at researching and digging. We'll get you answers back as soon as possible.
Guys, I wasn't cutting you guys off. I just meant if you came back later and had it. These are great and wonderful questions, as Sean had said. It's really good to sit and listen to these. Were there any additional questions on Surebridge?
Not on Surebridge, but maybe on something else.
Okay.
I had a question about QHC, but before going to that, I'm gonna mention something similar to what Joanne mentioned. Like the dental and vision providers, I had a similar issue with the general physicians in the area. The list that we received and the list that's available online, they don't match. I'm not sure what's missing there. So my request would be to look into that and see if which list is updated and inform that.
The list you received on via email, did it come from the same website?
The list I received, I'm Ronit, I'm the president of Graduate Student Government. The list we received was during the RFP, and that list doesn't match the list that's available online.
Oh, gotcha. Okay, that's a good point. It could be that the providers have changed. That could be one possibility, but yes, let me definitely look at that. I assisted with that RFP, so I have access to that data, and I'll double check and see where the disconnect is coming from.
Great, appreciate it. Thank you. I have a question regarding the QHC. So I wasn't sure. So you said QHC qualified health coverage, it's covered, right? They will receive a letter. The students can receive a letter that said the qualified health coverage is covered from UHC.
So Reddit, a letter will go out, and I've shared a demo of the letter. I've sent it to Rochelle, so I'm pretty sure it's gotten to Samantha or Joanne by now. But it's gonna. Oh, sorry.
So Alex, sorry to interrupt you. Michigan Tech did not receive it. Joanne and Sam just nodded they didn't receive it.
Okay, no problem. I sent that probably a week ago, but I will send that to you, Samantha and Joanne, as soon as we hang up the call, just so you can review the letter that would go out. But as I mentioned, for a student to request the letter, they'd have to call in and request it from customer service. So we'll talk about qualified health coverage. Then it will define what qualified health coverage is. And then you put your name, date of birth, what your policy name is. So that would be under Michigan Tech University, because they're the policy holder. And then you would check whether your policy is a qualified health coverage or if your policy is not a qualified health coverage.
Okay. And Michigan Tech policy is qualified health coverage. Is that right?
At the current moment, I would answer that as no, because one of the reasons for qualified health coverage, you need to not exclude or limit coverage for motor vehicle accidents. And if you look in the certificate or summary brochure and you look at exclusion number 19, it does limit coverage.
Is it
So
being looked into right now?
I'm sorry.
Is it being looked into right now? Because initially when we had the discussion that it was discussed that the plan would be, the health plan would be same as the previous one. I guess it's one of the things that got missed, just like skiing and other exclusions.
Yep. And again, I've sent follow-ups to have this reviewed. I can connect with Joanne and Samantha after this call, if that's all right. Joanne and Samantha to discuss, but that's something we can definitely look into. But as you know, I think we had to go through some steps here to get documentation from Blue Cross Blue Shield, which I know hasn't been as easy providing that information. And once we receive that, we have to check in with our underwriting department to get approval. Does that make sense?
Is Rochelle on the line right now?
I do not see her on the line.
Okay, she had emailed me and said she was on the call. I wonder if she jumped off the call. So that might be something we have to work with Rochelle on, Alec, for an update.
Yep, absolutely.
All right, we'll call her.
Once, I guess it might be difficult to know right now, but do you have any tentative timeline once this call happens, how long it could take for your underwriting department to come up with an answer?
I do not right now, because I would need the documentation from Blue Cross Blue Shield first. So it depends how long it takes to get that from them.
Okay. The second question I would have is, so we had a couple of exclusions, and thank you for removing those and amending the main document. Is anyone communicating those amendments to the students? Are you sending those who are enrolled to the students saying, hey, these are the amendments that were made and these exclusions were removed now?
We are not. So what we do is we make the, once we have approval from underwriting, we go back to our team to make the necessary adjustments in the certificate. And then what we do is we send a updated certificate and summary brochure to Aon to forward on to the school to approve any updates that have been done.
As the students are direct customer of they are enrolled in the UHC plan directly, would it be possible for you to send an announcement every time you do an amendment saying that, hey, this is something that changed in your plan, and
So,
do it?
Unfortunately, don't have those capabilities. So I understand the students are the end user, but the policy holder is actually Michigan Tech University. So that's why it's all communicated through the consultant and then back to the university. Maybe the consultant may have access to be able to do something like that, but we pass everything on to the consultant at Aon to get back to Michigan Tech University.
Okay, thank you.
May I follow up just a little bit, Alec? This
Yep,
is
go ahead,
Tracy.
Tracy.
Our actual plan document as well does have an announcement on the front cover. It says, please note this document has changed. And it'll say, please see the back cover for detail. The last page will list all of those changes that were made, the dates that any changes were made. It'll be a running list throughout the year. So if we do a change, let's say in August, and then we do another one in October based on feedback, we will list all of those cumulatively. These plan documents are reposted to uhcsr.com, the site /MTU, the site we showed you. They're also available through a student's My account. So students always have access to open those documents. And if they open it, and they'll see that announcement on the summary brochure and on the certificate, the larger document that will point out that there have been changes.
I understand that, Tracy, and that's how I found about the amendments as well. But considering the students were the end users, they have to proactively look for those, which is why I was asking if you guys do it. I appreciate your response.
I just want to say too, every student that's reached out to me, I have personally come back to let them know the update on it. When we had a whole bunch of exclusions at one time, I had a whole list of them that I was sending to people. Brittany, I think you've been involved in all of them, so I have always updated you, and you've had some people to reach out to as well. So that's how we've been communicating it. But like they've said on the website, you can see the date that it was last updated. and the amendments are on there. So if there's somebody who doesn't know about these, they can access that information and see the changes that did happen by going on the website, unless they personally reached out to me or anybody in the department.
Any other questions from the Michigan Tech Group? Yes.
So I had a question regarding the qualified health coverage. Sorry about that. Yesterday, actually, I called the customer service for that document, and they had no idea what I was talking about. So till what timeline, like in what time frame should I call them back for that document?
Yeah, so right now, if you call for that document, they would be looking at the plan and seeing, they'd send this letter to you. And you would have to probably check that your plan is not a qualified health coverage due to the following, that the policy excludes coverage for motor vehicle accidents. So it's kind of up to you whether, if you want that letter, we can do that and you can check that box, or if you want to wait and we wait to hear back from Blue Cross Blue Shield and showing proof that it's outlined in their coverage from last year. And then the process that we have to go back with underwriting and trying to get the exclusion removed, because then if that exclusion is removed, then your plan would be a qualified health coverage. So to be very frank, it's in limbo right now. We're waiting on the consultant to reach out to Blue Cross Blue Shield to provide documentation to show to our underwriters to remove the exclusion.
Okay.
Okay, we do have another question here.
Alec, I think this would be quick, but
Yeah, no worries.
someone reached out to us saying that they were in the Blue Cross Blue Shield plan previously when they visited ER. They haven't received the bills yet. What should they do now? Now they're in the UHC plan. What happened?
Yeah, so if it happened when they were still under Blue Cross Blue Shield, that would still go through Blue Cross Blue Shield.
And is there anything students specifically need to do now so that it doesn't come to them through UHC?
No, it would not, because they would probably show their ID card at the time, which was under Blue Cross Blue Shield, so it would go through them.
All right, thank you, I appreciate it.
Yep, no problem. Any other questions?
Maybe
I will say, if more questions do come up, please feel free to share them. I don't want to put too much on Samantha or Joanne's plate, but if you want to send them to them and then forward it along to us, myself or Tracy, Sam or Joanne, we can definitely take a look at any additional questions that may come up, because I know sometimes, I'm sure it's a big room, might not want to always speak up or might think of something later. So please don't think because you didn't ask a question today that we can't get to it. So if something does come up later, please let us know.
great. Thank you so much, Alec, and our UHC team for your presentation today. Thank you, Renee, for organizing this. We'll be in touch. Definitely, there's a couple things I'll follow up with you on. Thanks to appreciate your time.
Thank you, everybody.
All right.
Thank
Thank you, everyone. Yep. I hope you have a great day.
Take care, guys.
Thank you.